Welcome back. In this deep dive, we're taking a whole stack of information and giving you that essential shortcut. Today, we're looking at getting tested for diabetes, especially for anyone listening in the UK. Okay, let's unpack this. Our guide today is a set of really clear rules from the experts at Blood Test UK.
That's right. Our mission is to help you know when you might need a checkup and, why it helps so much.
Yeah.
We're really focusing on UK health guidelines and the huge benefits of checking early.
So let's start there. What are the simple reasons someone in the UK should even start to think about getting a test?
Well, the criteria are actually very clear. The first big one is if you're over 40. That's sort of the baseline.
Okay, so age 40 is a trigger.
Yes. And then if you have a mom or dad or a brother or sister who has diabetes, that family history is a major factor.
And what about lifestyle? I know that's a rising concern.
A huge concern. Being overweight is a big one.
Yeah.
And also just not moving around enough or having a diet with a lot of processed sugary foods.
And the sources from Blood Test UK, they also highlight that for some people, that age 40 marker isn't even the right one.
That is a crucial point. UK health statistics show that people from South Asian and African Caribbean backgrounds have a higher risk.
So they might need testing earlier.
Exactly. They should really think about it well before 40. It's really important localized knowledge.
Okay, so let's say someone is worried now. What are the fast signs they should be looking for? This is where it gets really interesting.
You're looking for a few key things that often appear together. The most urgent sign is peeing a lot more than you normally would.
Right.
Also being really, really thirsty. A thirst you just can't seem to quench.
Okay, what else?
Losing weight without trying to.
Yeah.
And just feeling super, super tired all the time. Extreme fatigue.
And I think I read about fuzzy eyes, blurred vision.
Yes, that's another big red flag.
So if you notice those signs, what's the next step?
You need to see your local GP.
Yeah.
Your general practitioner. Just call him right away.
Don't wait.
Do not wait. Use the NHS resources. These signs are serious.
Let's focus on the good news now. Why does checking early help so much?
If we connect this to the bigger picture, it's all about preventing the big sicknesses later on.
Like heart problems.
Exactly. Heart problems, nerve damage, kidney issues. Early testing and management helps stop all of that before it can even start. It leads to a much better quality of life.
And what about this idea of pre-diabetes? That seems to be the real win here.
It is. That's the golden window. Finding prediabetes means your sugar levels are high, but you haven't tipped over into full diabetes yet.
Because you can actually stop it.
You can. You can make changes like eating more fruits and vegetables, and you might completely prevent the full disease from ever starting. It's a direct off-ramp to better health.
And what kind of tests are we talking about? When you go to the NHS, what do they do?
The main one's the HbA1c test. It's great because it checks your average sugar levels over the last 2 or 3 months.
So it's not just a snapshot of one day.
Right. It gives a much better overall picture. They might also do what's called a fasting plasma glucose test, which checks your sugar right at that moment.
And just to remind everyone, these recommendations, they all come from Blood Test UK, who really stress that taking action early is what prevents complications. So what does this all mean? It seems like knowing your risk, especially that age 40 mark and those community factors, and then spotting the symptoms early is really the best way to keep yourself healthy.
Absolutely. And, there was one final thought from the source material that really stood out. Blood Test UK noted that people with less money or who live in certain areas sometimes have higher rates of diabetes. And it raises a really important question. How much does where you live and what you have access to, like good food or safe places to exercise, change your chances of staying healthy?